Good afternoon, everyone. Thank you for joining us today. We will get started momentarily with our Planning for Care series webinar on the financial reality of caregiving. Oh, good afternoon. Thank you for joining us today. Would like to welcome you to our second installment of the Planning for Care webinar series hosted by Caregiver Action Network. Today's topic is the financial reality of caregiving and why planning early matters. My name is Amera Bilal. I'm Vice President of Programs and Policy for the Caregiver Action Network, and I'm so glad that you're here with us today. Caregiver Action Network is an organization dedicated to supporting the interest and providing resources and tools to family caregivers throughout the United States whose current number in the millions. Almost 63 million people count themselves as unpaid family caregivers and really are deserving of the support that an organization like ours can provide. We are providing this information today just in support of the different facets of caregiving that people might encounter, not least of which is the difficulties and the challenges of how to plan for your finances, how to strengthen them, and how to protect your interest and the interest of your loved ones as you navigate the caregiving relationship. I'm pleased to be joined today by Ms. Ileana Gonzalez, who will be our speaker today. Ileana brings a distinctive blend of financial expertise and whole person care to her work in the caregiving market. Through Heritage Wealth Group, she helps individuals and families navigate retirement planning with an approach that recognizes the financial and emotional realities caregivers often face. Her background in wellness, including the founding of Aperva Wellness, adds to a strong understanding of balance, stress, and long-term well-being. Combined with years of strategic consulting, Combined with years of strategic consulting and financial guidance, Ileana offers caregivers and families thoughtful support at the intersection of faith, life planning, and financial security. Thank you, Ileana, for joining us today.
Thank you. Thank you, Amera. And thank you to everyone at the Caregiver Action Network for the invitation to be here today. So I want to start the conversation with a question that most financial conversations skip entirely, and that is your family ready for the reality of caregiving? At some point, most of us will either need care or provide it for someone we love. The question isn't whether this will touch your family, it's really whether you'll be ready when it does. And this is not about instilling fear. It's actually just about being able to gain clarity and being able to know the different layers that families have to navigate, and understanding that the people who are managing caregiving the best are not necessarily the wealthiest. They're just the ones that did the planning early and were able to have the conversations early on. I'm going to walk you through some specific areas in terms of planning, like legal documents, financial coverage, knowing the numbers, having the family conversations. But before we do that, let's take a look at really what the scale of the crisis is. So we know that about 63 million Americans are unpaid caregivers. And these are all from, this number is from an AARP report in 2025. And that's, that's not like a niche issue. That's really nearly 1 in 5 Americans. We also know adults provide care. So if you're on this call today, it's you're probably already a caregiver, or you are preparing to become a caregiver, or maybe you will need it yourself. It's really that pervasive. And the staggering number is that by 2034, there will the adults over 65 will actually outnumber children and adults that will be able to care for them. So really planning now will make a big difference, and will put you and your family in a better position when the time comes. So if we talk about what caregiving costs families, 72 over $7,200 is the average out of pocket per year. And we'll take a look at where some of those expenses are going. But if you think about medical supplies, the modifications you have to make in your home, prescriptions and all of those things, these expenses add up. And what happens is that a lot of these costs are unexpected. So that means that they're not always going to come from like your emergency fund or your rainy day fund. That 10,525 average cost is for people who are for working caregivers. So this is with work disruptions, people actually having to work to cut into their work schedule to take care of transporting the person to medical appointments. So again, all of these costs really stack up, and about 26% of the annual income is actually spent on caregiving. So 50% will go to housing, 20% to medical care, and 29% to transportation, food, and other needs. So the burden obviously, it is financial. But the other interesting fact about what is happening with caregiving is that the burden falls disproportionately to women. So we know that about 2/3 of those 63 million are women. These are daughters, wives, sisters, daughters-in-law that are stepping up and stepping away from their own career to take on the role of caregiving. And this impacts in a very indirect way when you consider that they're walking away from lifetime earnings, but also walking away from a potential Social Security gain. So obviously, if they're not working, they're not contributing to Social Security. And this also adds up to, almost $324,000 of lost potential income. And we know that women outlive men, right? By 5.3 years on average. But this also means that because they've taken on this role, they arrive to retirement with less savings, less, like I mentioned, the less Social Security. So it's just puts them in a financially vulnerable place. And on top of that, a lot of these women are what we call the sandwich generation. Women who are, early 40s, late 50s, and it's like the perfect storm. They're taking care of their kids who are maybe they're leaving home to go to school, so they have to deal with college tuition costs. They are at the same time they are walking away from their career, from their potential contributing to their retirement savings. They're still paying a mortgage. Now they have to maybe take on some of these caregiving costs. So the sandwich generation is really hit pretty hard when it comes to the financial burden of caregiving. And of course, caregiving itself takes a toll on the caregiver. And studies show that caregivers are also vulnerable in terms of depression. They have a higher mortality risk. There's a lot more stress in their relationships. And this, over time, it takes a toll. And some caregivers, 20% have reported that they saw a decline in their own health because of caregiving. And really remember that your own health is a financial asset. So it's important for you to take some time for yourself during this time of caregiving, because the emotional toll, the physical toll, it all catches up to you. So if we look at specific numbers um, of what caregiving actually costs, the numbers are really staggering. These numbers are median costs from 2024. Adult daycare. This is probably the most affordable option for families because the the patient can stay at home, but they can go to a facility where they will be, supported and supervised during work hours. So this will allow the caregiver to continue working, maybe part-time, maybe full-time, and knowing that their loved one will still be taken care of. Assisted living can cost up to nearly $6,000 a month. And this is really like, middle ground, nothing like luxurious. Um, but it provide assisted living provides a little bit more support than they would at home, but it's not as intensive as a nursing home where they have round the clock medical care. And so you really have to kind of think about which option fits better for the needs of the patient, but also for your pocketbook, right? Where is this money gonna come from? If you hire a home health aide at about 44 hours a week, it can cost up to almost $78,000 a year. And really, the nursing home option is probably the most expensive option because, as I mentioned, these are facilities where they have round the clock medical care, and so this unfortunately may have to be the only option for a lot of families if they're unable to be taken care of at home. So really, again, the idea is not to scare or to overwhelm, but it's more about like this is the reality. Knowing these numbers is going to help me figure out how I'm going to finance this. And again, this is where planning really becomes valuable, because when you understand the numbers, you're able to plan with more clarity. So let's look at some areas where early action makes a big difference. These are all things that you can start looking at now. The legal documents really are probably the area where most families procrastinate, but they can actually make the biggest difference when you are in a time of crisis, right? So don't wait for that moment of crisis. It's something that you want to take care of as soon as possible. There are lots of low cost options. There are online options. So these are examples of some of the more important legal documents. It's not an exhaustive list, but it's definitely, it should definitely be on your checklist to see if these would fit your situation. So the power of attorney, this allows someone that like a trusted person, like a spouse, an adult, child, or a sibling, to manage the person's financial life if they are unable to. So the bills can get paid, major financial decisions can be made. And if you don't have this, then it will it will delay things. It will delay a lot of things. The person might not even be able to, not just pay the bills, but maybe not even have access to their money. And you'll have to go through a lot of paperwork at the financial institutions, and it could actually end up costing a lot more than if you had the document in place. The healthcare proxy, this is different from the financial POA. So the power of attorney is more for financial matters. The healthcare proxy is when you designate somebody who's going to speak for you in terms of medical decisions. The person who you assign as a proxy can be in the room when doctors ask, if a decision needs to be made about treatment, and it should preferably be someone who knows you, or who knows the person, to well enough to understand what they would actually want. um, the living will is a document that expresses your wishes in writing. So this is what I want to happen with each of my assets. But please understand that a will is still public, and a will is often not enough. So with a will, your family may still have to face probate. So the probate process, depending on where you live, can be exhausting and very expensive. It can delay your family acting out on what your last wishes are. So a will is not enough in most cases. Uh, People, depending on what assets you have, it's also important to have a trust, because a trust is completely private, and it will save your family a lot of time and money from probate. These physician and medical orders also are like very specific, actionable orders that you want. This is especially good for seriously ill patients. Like if they don't want intubation, if they want to forego any life sustaining care. It's just another layer. It's another layer of making sure that the person's wishes are going to be carried out and respected. Um, and then beneficiary designations are actually a lot more important than you think. This is an area that a lot of people forget. And like, for example, if you are divorced and you forgot to take your ex-spouse off of your life insurance policy that you have through your work, and then something happens to you, your current spouse is not going to get that death benefit payout. It's going to be the person, your ex-spouse, which is the person on the policy. So reviewing beneficiaries is really important. Looking at retirement accounts, your life insurance policies, um, the beneficiaries on your bank accounts, like all of these things, even if it's in a will or a trust, whatever, whoever is designated as a beneficiary is trumps everything else. So really be careful with that. And the HIPAA authorization, again, is just another layer where a trusted person can access medical information, um, and that can help in making medical decisions. The second area to look at, once that legal foundation is in place, is what financial coverage is available when care is actually needed. So a lot of these things, it's better if you plan ahead. So if you are already in a caregiving situation, these things might not be accessible because things like long-term care insurance and life insurance need health underwriting. And so obviously if the person is already, oh, what happened to my, oh, sorry. If the person is already in a, is already ill, it will be very difficult to get them through underwriting. So this is a good example of how planning ahead and putting these things in place can make a big financial difference to your family when that time comes. So traditional long-term care insurance, this is the classic approach. You pay a premium, and then if you need qualifying care, the policy kicks in a specified benefit amount for a specified benefit period. Um, Long-term care insurance over the years has changed a lot, and it's a lot more efficient now. And there are policies that are actually they check a lot of boxes in terms of the ifs in life. So these hybrid life insurance and long-term care policies, if you with a traditional long-term care insurance, if you don't use it, you lose it. That's kind of like the term life insurance, right? But with life and long-term care hybrid policies, you have if you need long-term care, it kicks in, but if you don't, that money still stays there, and the death benefit is tax-free for your beneficiary. So they're designed to be a lot more efficient now. We also have annuities that come with a care rider. So what happens is if you have this rider on the annuity, it gives you a multiple. It multiplies the principal amount by whatever percent, like depending on how you designed it when you bought it. But it can also make a huge difference. These are all ideas where you're planning ahead for an expense that may be coming. If it doesn't come, that's okay because you don't lose that money. You have other protections in place. But the important thing is that I'm not going to be scrambling to find where the money's coming from. And I also don't necessarily have to drain my own resources. I don't have to drain my own retirement or my own savings. The health savings account, a lot of people use it as a sort of like a short-term reimbursement account, but actually the most efficient way to use your HSA is to leave it there. Leave it, and like any other investment account, just watch it grow, because when the time comes, you can draw from that HSA, right? So it'll, let's say that you got it from your job 20 years ago, it's been growing for 20 years. Now you're in your 60s and you need long-term care and you have those funds there. So it's a very, very tax efficient way to use the HSA. So try to avoid using it for your short-term healthcare costs. If you're caring for aging parents, it's important to know what they have. Maybe they bought a long-term care policy 20 years ago that they forgot about, and it's sitting at the bottom of their drawer. Maybe they have life insurance that has living benefits, which we'll talk about in a couple of slides. So find out what your parents already have. Chances are they did plan ahead 20, 30 years ago, but it just, they forgot about it. It's been collecting dust. So it's always good to sit down and review with them what they have. And then Medicare, I really feel like it's important to do a reality check about Medicare, because the one thing that I always hear is that, there's a misconception about exactly what Medicare covers. And unfortunately, Medicare does not cover the things that you think it covers. So, people assume that, well, I have Medicare, so that's going to pay for my long-term nursing home care. It's going to pay for my in-home custodial assistance. And as long as I have my Medicare, then I should be okay. The reality is that Medicare will only pay the first 20 days of a skilled nursing facility. And this is only after you have had to stay 3 consecutive days in the hospital. So the hospital stay has to happen first, and that triggers that they're going to cover the first 20 days. From day 21 to 100, there is a copay. So the copay for 2026 is 217. So again, like those costs add up, right? Um, and that's the copay. Plus, remember that there's always a percentage. There's always a percentage that Medicare won't pay. So you'll be responsible not just for the $217 copay, but also for the remainder that they don't pay. And then after the 100 days, so day 101, it comes completely out of your pocket. Unfortunately, Medicare does not pay for custodial care. So this is when the person needs assistance with the activities of daily living, bathing, dressing, eating, toileting, things where that person really cannot be left unsupervised for, many hours at a time. And so Medicare does not pay this. This would have to come out completely out of your pocket. The only thing that Medicare does pay for is hospice care, but it'll only pay for hospice when you have been given six months or less to live. So I mentioned accelerated benefits of life insurance, and many life insurance policies offer this. So when you do your life insurance review with your family, and even with your own policies that you have for yourself, it's important to take a look to see if your policy has these accelerated benefits. So for most companies, these are no cost riders. So they're built into the cost of the policy, and they take these 4 triggers into consideration. If any of these 4 things happen, the policy will pay out a percentage of the death benefit upfront. So this means that, like the traditional model of life insurance is that you have to die, right? You have to die first, and then your family gets the money. With accelerated benefits, they're called living benefits because you're alive, but you have either a terminal illness. So a terminal illness is if your life expectancy is less than 2 years, and the money that is given to you and your family can be paid for anything medical, for your care, if you have to travel to another state to see a specialist, even if you want to take a vacation because you say, hey, I don't know how long I have to live and I want to spend it with my family. The only thing that you need, obviously, is for the doctor to say, this is a terminal illness. Chronic illness is, it's usually defined as when you can't perform 2 or more activities of daily living. So remember, bathing, dressing, eating, toileting, things like that. And that this is going to be ongoing, right? So even though it's not life-threatening, but you're no longer really independent enough to do these things for yourself. Critical illness are things like heart attack, stroke, cancer, and these are actually the top killers in this country. So the fact that these types of riders exist on life insurance is really a game changer. It's really important, and it can make a huge difference for your family when the time comes. And then Alzheimer's and Lewy body dementia, these are very specific, cognitive impairments. But 7.2 million Americans are currently living with Alzheimer's dementia. So the likeliness of this happening to you and your family are very high. And so, as I said, accelerating these benefits, you can use it for just household expenses. If you need to make a modification to your house, if you need to pay for an adult daycare or any kind of facility, or even if you just want, a little bit better quality of life as you are dealing with these things. So definitely talk to your, family and do that life insurance audit, because this could be a game changer. Knowing the numbers and family conversations. So as I mentioned before, the families who are navigating caregiving more successfully are not the wealthy families. These are the families who were able to have the conversations early, um, and not just knowing the numbers, but also knowing what the family has. How can we pool together our resources? How can we pull together our time? Right, time is a resource. Not putting the burden only on one person. So as far as knowing the numbers, it's what can we pull from? Does the person have pension? How much savings do they have? What are the investments? What do the investments look like? Do they have retirement income? Like, where are they as far as the different resources that we can pull together? You must have the full picture so that you can make those decisions with clarity and with information. Part of knowing the number, of course, is what does the get care cost in your area, right? So we looked at the median numbers across the country, but maybe you live in a part of the country that is, quote unquote, more affordable. I don't know what part of the country that would be, but perhaps just looking at, just doing a little bit of your own market research in terms of what these different facilities, what these different kinds of specialists cost. Because when you know the cost, then you can plan how long can my existing assets sustain the situation. So if you know that the overall cost is going to be $111,000 a year, and the person has $300,000 in savings, then you know more or less that that care is going to cost 3 years and what's going to happen after the 3 years, right? So again, this is not to scare you. This is not to, shame you or anything. This is just like in order to make an appropriate plan, we need to know the numbers, and we also have to have the conversation. So asking the person, where do they want to live? Do they want to stay in the home? And if so, will that require modifications? Is family important to them? Is being near their friends important to them? These answers will shape the decisions that you make in terms of, the where and the how of the care. Um, Make sure that you understand what their wishes are for end of life care. Make sure that you have those documents in place so that when the time comes, you're not scrambling and, making decisions that you're not sure if the person would want, right? So don't be afraid to have these conversations. Who will be the primary caregiver? I mean, as we saw in previous slides, we assume that it's going to be the wife, or we assume that it's going to be the daughter or the daughter-in-law, right? But maybe that doesn't make sense. Maybe it doesn't make sense to pull the highest income earner from their career to be the primary caregiver. Maybe we have to just be really explicit about what makes the most financial sense. And then talk about who has legal authority, who is going to be designated as the power of attorney, who is going to be designated to make those really, really difficult financial and medical decisions in the moment, right? At the time of an emergency. And so one of the suggestions that I have made over the years with my clients is have a binder, just a plain notebook or a folder or somewhere. It's a centralized container where you can put all of these things. You can put the legal documents that we talked about. You can put the insurance policies. You can put the list of medications, the list of the physicians in charge, people that I need to call if if I need to make a financial decision, the advisor, the guy at the bank, who do I need to pay the mortgage to? Like um, all of this information that is going to save you so much time and trouble when you find yourself, in a really critical situation. So just have a binder and make sure that everybody knows where that binder is, so you can easily access it. And the last part is really, how do I optimize what I already have? Let's say I'm already in this caregiving situation. Let's just say that for whatever reason, I wasn't given the opportunity to plan ahead, and here I am. I've kind of been pushed in this situation, where I find myself being the caregiver. Some simple steps is, like I said, it's important to know the numbers. Let's take a look at everybody involved, all of the family members, or who whatever that circle of people who consider themselves, not just the caregiver, but sort of like the responsible parties for this person, the person's future. Let's audit the existing insurance policies. Maybe there is a hidden rider that they forgot about. Or maybe if I talk to the insurance agent, there is something that we can do to shift, the something in the policy. So a policy review can actually unlock a lot of these benefits that the own policyholder may not have really been aware of. Review the IRA and 401k distribution strategies. So remember, and everything that you are currently contributing to your IRA and 401k are all pre-tax, which means that at some point in the future, right now that is age 73. When you turn age 73, the IRS is going to force you to take money out of those accounts. But with proper planning, you can maybe accelerate those withdrawals. You can have a coordinated strategy where maybe you'll be able to extend those assets, or maybe put them in a different account that will protect that money, protect those assets better. So there's a lot of value in reviewing what you already have, because if you talk to the right person, to the right expert, they can really give you some valuable strategies. And maybe something like a family caregiver agreement, right? The person who will take on the role of main caregiver, have things in place that will protect them, protect their earning power, their own assets, protect their assets. And there are so many things. If you talk to an elder law or estate law attorney, can help you figure out ways in which the caregiver can also be legally and financially protected. So just to give you some next steps, there is, I think in the chat there, we're going to include a checklist. So these things that we talked about today, just to give you some like a centralized place for you to make sure that you're not missing any of these steps. So as I said, you want to audit your current coverage, make sure which legal documents you have and which legal documents you need. have those conversations, and then identify the gaps. Where am I vulnerable? Where do I need more protection, and how can I protect my family if something similar were to happen to me in the future, right? That it's being a caregiver sometimes is like that cautionary tale. It's like, oh gosh, I know what it's like, and I don't want my kids to go through what I went through with my parents, right? So be really honest about what do you think you still need to put into place. Can schedule a complimentary call with myself. I can have a 30-minute chat about where you think some of those gaps may be. We can do an overall review and audit of everything that's existing, and just help you get more clarity on what you need to build your caregiving plan. So I'm going to pass it on, and I think we have questions in the chat. Um, do you want me to just look at some of the questions, or do you want to read me some of the questions?
Yeah, I'll pull them. I'll pitch them to you. Thanks. One thing that was asked, or what are some questions to ask an insurance professional to make sure that you have a good one?
Yeah, that's a very good question. You want to definitely understand what those riders are. Again, not all companies have those advanced, they're either called advanced benefits or living benefits. That's one thing you definitely want to understand if it's included. If depending on what kind of a policy it is, you want to know if there is a time limit on it, right? So if it's a term policy, do you have 10 years left? Do I have 20 years left? If it's a whole life policy, what is my cash value? Maybe I can get some funds out of that old life insurance that my grandmother bought me when I was 5 years old. Um, so just sitting down with the life insurance professional and just reviewing what benefits the policy can give you um, before you die. So while you're still living.
Okay. And for estate planning, what are your thoughts on online resources like LegalZoom, Legal Karma, etc.?
Um, I think the online resources for wills is probably enough. A will is it's a very simple document that says, this is what I want, with everything from like my house to like, that diamond ring that's been in our family, right? It like
Right.
it can literally be anything that you want. If you want, if you have a lot of assets, a lot of different kinds of assets, if you have a house, and you have like a beach house, and you have a lot of other types of assets, your investments, or all of these things, I would highly recommend that you do put them in a trust. A trust is armored. It's a lot more protected than just a will. If you have just a will, your your third cousin's neighbor can come and say, "No, no, she told me that I could have that ring when she died," and your wishes are not going to be carried out unless the judge has the final say, right, on a will. But if you
Right.
want something really ironclad, I would talk to a professional for a trust.
Absolutely. And thank you for that insight. We have a few more questions from our Q&A. We'll try to take as many as possible. But in the event that we are not able to get to every question,
Mhm.
we are available for follow-up. Our contact information will be provided at the end of this presentation. So thank you for plugging questions into the chat. Nicole, do you have some questions you want to share with us?
Yes, absolutely. There have been some really fantastic questions that have come through the Q&A functionality here in Zoom. And so I wanted to bring some of those up to have you both chime in. One question came in from Kim, and she asks, is this information only geared to caregivers who are caring for an older loved one, or is this also for families that are caring for children with significant healthcare needs?
Absolutely. It really is intended for anyone. That's an excellent question, and thank you for asking. If you have, that specific, if you have that specific situation, the one thing I would add to legal documents, of course, is your guardianship. The trust should have a special needs clause. Guardianship is 100% like the first thing that you should do, because a guardianship is if something happens to you, the caregiver or the parent, who's going to take care of that child. So if you don't already have a guardianship, I would say please do that like today, because you don't want that also to be left up to the court to decide who's going to take care of your child. So a lot of these things we can tweak them to fit your specific situation. So what we gave today is in general for caregivers of any age, but of course for specific situations there are some other layers that we would talk about.
Yes, absolutely. Thank you so much. Another question that came through, and I felt like this is such I think a great, straightforward question, which is long-term care insurance really expensive for older adults and kind of getting into that 60 and older range?
Yes, it can be costly because long-term care, like any life insurance, will depend on your age and your health. So obviously, the earlier you get it, the cheaper. But it's ironic, right? Because when you're 30, you're not thinking about your long-term care needs. However, that being said, that doesn't mean that it doesn't make sense, right? It depends on your situation. If you think about long-term care and if you think about how much long-term caregiving costs over time, paying a long-term care insurance policy, maybe that makes sense. Maybe that would save you money in the end, right? So even though, yes, the answer is it is expensive the older you get, but that's not to say that it still wouldn't make sense in that situation. And generally, we use a guideline for long-term care is we don't want it to cost more than like 7% of our income. So that's kind of like a general guideline, but again, we'd have to look at like your specific situation to decide if it makes sense or not.
Yeah, no, and I think that's such a great way to look at it too. I mean, to me, it feels, that's the kind of thinking that we apply with our health insurance. We may choose, plans based on what kind of coverage we need. Maybe we need different
Mm-hmm.
tests to be covered, specialists. We need to have certain flexibilities. And so that is going to make it cost more, but
Yeah.
then we're probably saving some down the line.
Yeah.
If it's something that we're going to use. So I appreciate you speaking to that. Another
Mm-hmm.
question that came through, and this is kind of a scenario here.
Mm.
Um, so we had someone ask, should we put mom's house in our names to prevent losing it to a care facility in the future? How many years ahead do we need to do this before
Mm.
she transitions into an assisted
Wow.
living or nursing care facility?
Yeah, that's a really good question. I would definitely defer that question to an estate planning attorney.
Yes. Yes.
And it'll depend a lot on what the tax, because if it's not just as simple as like putting it in your name. You have to pay taxes for that, and you have to so it's not that simple. If you're talking about Medicaid planning, I think the Medicaid look back period is 5 years. So, um, if you think that is going to happen in the future, I would definitely start planning for that. But I think that is a better question for
An
an
estate
estate,
plan.
yeah, for an estate planner.
Well, thank you for your insight. And Nicole, thank you for fielding some of these questions. If we didn't get to every question, we will follow up. And I'm
Mm-hmm.
also going to make our contact information available for everybody who's on the webinar. You should also know that the replay of this webinar, including the presentation deck and all the information there, will be available to you on our CAN website, Caregiver Action Network website. Ileana, thank you so much for joining us today.
Thank you
Before,
so much.
thank you so much. You presented a breadth of information, and it can be overwhelming to take all of this in. But
Mm-hmm.
as it was noted in the chat, there's such a deep appreciation for not only the data but the real storytelling that you gave in the
Mm-hmm.
presentation of this information. I think it was very palatable for our audience, and I just wanted to say that we appreciate you, leading us down this conversation, and we definitely hope to work with you in the future
Mm-hmm.
as we hopefully do more of a deep dive on what is available. If I could have you to progress in the slides so that I
Mm-hmm.
could talk a little bit about CAN's resources. One more. Okay. So we welcome everybody who's in the audience to check out our website at caregiveraction.org/toolbox. There you'll find a family caregiver toolbox. We also have the National Family Caregiver Help Desk, which is our phone-based and app-based support service for caregivers who are looking for information, who are looking for encouragement, looking for navigation services that are readily available. Nicole, did you want to say a little bit more about our help desk?
Yeah, I would just make sure to add that it's not a 24/7 line. It is Monday through Friday, 8 a.m. to 7 p.m. Eastern. But that doesn't mean you can't reach out anytime. You'll be able to leave a voicemail or send an email. And the folks there are amazing at getting back to you very, very quickly.
Absolutely. And this is our second installment of our Planning for Care series. The third installment, which will discuss how to select a long-term care facility for your loved one, will be held on Thursday, May 28th at 2 p.m. Eastern Time. We hope that you will join us again for that information. The first installment of this series, which focused on long-term care insurance, is also housed on our website and can be replayed at any time. Again, I want to thank our audience today for joining us. I want to thank our speaker, Ileana Gonzalez, my team at CAN, including the program and policy team, as well as Paula Zambrana, who leads us through all of these community engagement activities. Thank you so much for the development of this webinar and its content. Thank you so much, everyone. The information will be available on our website. Have a wonderful afternoon.